Welcome in, everyone. Another edition of Sports Medicine Weekly on this Saturday morning. I'm Steve Kashul, the Chicago Bulls radio host. I'm co-host here of Sports Medicine Weekly. Joining me again this week is Dr. Nick Verma from Midwest Orthopaedics at Rush. He is the head team physician for the Chicago White Sox, subbing again this week for Dr. Brian Cole. Hi, Dr. Nick. You had a good week?
I had a great week.
Good. Hey, I want you to tell our audience your role a little bit for being the head team physician for the Chicago White Sox, how you've enjoyed it, and give me a story that we may not know. One of your favorite training room stories from the Inside the Clubhouse.
Sure. So, my role as the head team physician is really to be the quarterback of the medical services, so to speak. So, we're there from everything from initial evaluations when players come to the club, to assess their health level, to address any injuries or ongoing concerns that they may have, all the way up to managing injuries and then managing recovery from injuries and then managing return to play. So we really are in charge of making sure that our athletes stay as healthy as possible, number one, and number two, give them all the tools that are necessary to give them the best chance of success on the field as well. The great thing about being a team physician is that we don't do this job alone, and it really cannot be done alone. It's a team effort, and we've got a lot of valuable individuals in our training room. It starts with our training staff, which includes our athletic trainers, our strength and conditioning coaches, our nutritionists, our physical therapists. We've got colleagues that work with us at Rush, our primary care sports medicine physicians who take care of all the things like coughs and colds or abdominal pain or GI illnesses, things like that. And then we've got all the consultants at Rush. So, a good example is this past year when we had one of our players go down in the dugout with an aneurysm.
Yeah.
And, that's not an injury that you would think about in baseball, but that's an emergency situation that needs to be responded to. And, I'm happy to report that I think he was in the ER within about 26 minutes, had the appropriate assessment, and he's got a very good chance of playing baseball again next year.
That's amazing. That's great to hear.
So, those are the reasons why we do this and the stories of success that make you realize the contribution that you're making to the health and care of these athletes.
Great. So favorite story then? Which one jumps out at you?
I remember this was probably going back to 2008, I think it was, when we were in the midst of coming up on a playoff run. And Carlos Quentin had an injury to his wrist. He had a fracture and had to have some minor surgery to fix it. And this is something that would only happen in professional sports in this country. Is we set up a hyperbaric chamber within the training room. So this was like probably a 10-foot by 4-foot tent. And Carlos would come in every day. He'd get zipped into this thing. We'd pump up the pressure in there to try to increase oxygen to get this fracture to heal quickly. And he would literally come out to go to the bathroom or to eat, and that's it. And the rest of the training room was just going on as if nothing was happening. So we'd be seeing patients, people would be joking, there'd be things going on, and Carlos would be in the middle of this chamber, and he'd just be piping in the conversation like he's sitting on a training room table. And so, to have that happen in a professional locker room, it can only happen in professional sports. That's the only way where we try all of these weird and wacky things when the playoffs are at stake to try to get somebody back, even if it saves us a day.
Did it work?
He played. Whether he would have played without it or not, I can't tell you, but it certainly made us feel like we were doing something.
What does it do?
So what a hyperbaric chamber does is it allows us to increase pressure, right? So it's similar to if you think about scuba divers who are coming up from a deep pressure environment and you want to slowly bring them back to a normal pressure environment. It's basically creating a chamber where you can increase the pressure. And by increasing the pressure, you can increase the concentration of oxygen. And so the idea is that if you create a state that has a higher concentration of oxygen, you're going to facilitate healing. And so the idea is that they get better quicker from fractures or other soft tissue injuries just by increasing the amount of oxygen you're delivering.
Have you guys gotten into cryotherapy at all?
We have cryotherapy available. What's interesting is when you're in the training room setting, there are a lot of things that we do that may not be completely evidence-based, and our role is first and foremost to make sure that what we're doing is not going to cause harm to the athlete or to the patient. And once we recognize that something's safe to do, there are a lot of things that we do that may not have strong evidence to support that they work, but if they make players feel better, then that's a positive in our world. And if it feels like they recover more quickly with them, we have no problems doing things like cupping or cryotherapy or some of these other things that don't have a lot of great scientific data behind them. but certainly have a lot of experience and use in the training room and make our athletes feel like they get better quicker.
Visiting with Dr. Nick Verma. He's sitting in this week for Dr. Brian Cole. I'm Steve Kashul. This is Sports Medicine Weekly, segment number 1 here this Saturday morning. We've got a great show coming up, including our Ask the Doctor segment. And also we have Dr. Craig Delavalli, who's going to join us, joint replacement surgeon with Midwest Orthopaedics at Rush. We're going to talk a little bit about the aging athletes and their joints. Are we getting joint replacements at younger ages? And does our more active lifestyle contribute? Also going to mention Bo Jackson, who had a hip replacement and came back to play, one of the only pro athletes to do that. Back to cryotherapy, Dr. Verma. You were talking about that for the professional player. What have you learned, though, about the weekend warrior? Is it helping people? They're popping up everywhere, aren't they?
Yeah, they are popping up everywhere. And, the answer is I don't really know. I'm not sure. The problem with many of these new technologies is they get introduced. They generally come in a world where there's not a lot of regulatory burden for them to enter the market, meaning they don't have to prove that they're efficacious. They have some minimum safety requirements that they have to prove. And other than that, they can basically hang a shingle, start a business, offer cryotherapy, and make a lot of claims about what are the potential advantages of cryotherapy, even though they may not have the evidence to support it. So I think the key for patients when they're looking at things like cryotherapy or other newer treatments, stem cells is another one that comes to mind, is number one, make sure that there's not a safety risk, make sure that there are not alternate health problems that may be compromised by having this treatment. And then be willing to spend money knowing that it may not be a benefit for you. So I tell patients to try it. If it makes them feel better and it's safe to do, then it's certainly worthwhile doing. Yeah,
I was going to bring up the stem cell clinics popping up everywhere. You open up a newspaper and there's a full-page ad with some endorsements. I mean, whether it's a celebrity, an athlete, a sportscaster, sports writer, hey, go to this stem cell treatment place. But it's not regulated well. Is that safe to say?
Well, it's not regulated in the sense that it's not regulated like a drug is regulated. Okay. So there's not the burden on the company to prove that what they're using is working. Right? They have some minimum burdens that are required for safety requirements, but they don't have to prove efficacy, which means they don't have to have a study that shows that yes, this actually solves the problem that I'm going to treat you for. And so what that means is that these stem cell clinics can start making claims that they can cure everything from, your injured shoulder or your injured back all the way up to diabetes or spinal cord injuries or lots of different things. And unfortunately, they can really take advantage of patients that are in a compromised situation that are looking for, quote unquote, miracle cures. And so, again, it's another area where you really have to do your homework. You have to make sure that you ask the difficult questions about evidence that they have to suggest that the treatment that they are going to offer you is going to work, and really do your homework regarding safety concerns about is there any risk to you of doing the treatment. It's one thing to spend money and not have it work. It's another thing to then develop a problem as a result of the treatment.
And these stem cell treatments are expensive and usually not covered by insurance, correct?
They are all at this point considered experimental by both governmental as well as private payers, and that's because the evidence doesn't exist. The beauty of stem cells is that stem cells are basically the building block cells of our body, and as we're born, we all come from a single cell, and what happens is that cell then can differentiate into different body parts, right? So you take a stem cell, and the idea is that a stem cell can become a muscle, or it can become a ligament, or it can become a bone. So it's a very attractive thought in that can we somehow harness the power of these stem cells to regenerate damaged cartilage, to regenerate a torn ligament, to heal a partially torn rotator cuff. The problem is that it doesn't become as simple as injecting these cells into position. It's a very complex biologic process. We have to know what kind of cells, how many cells should be there, how do we get them into the right location, what's the time frame in which they're required, and what's the delivery vehicle? Is it really as simple as injecting them into the site, or do we have to do it with some kind of a delivery sponge or in combination with a surgical repair? So there's a lot of questions that are remaining. I think we will get those questions, and I think biology is the future of musculoskeletal medicine. And I think in the future we will get to the point where we're able to regenerate injured tissues. It's just it's in an infantile stage at this point, and I think the stem cell clinics are, again, they're just latching on to this desire by patients to find a miracle quick fix. And they're charging patients, $5,000, $10,000 for an injection in order to do that without the evidence to support that it works.
Great stuff from Dr. Nick Verma, head team physician for the Chicago White Sox, also orthopedic surgeon from Midwest Orthopaedics at Rush. Just getting started here on this edition of Sports Medicine Weekly, taking you up till 9 o'clock. We're going to join Bruce Levine and Matt Spiegel for Inside the Clubhouse. But up next on our show, we're going to be joined by a gentleman, doctor from Rush in Munster, Indiana, Dr. Jack Nicholas. Love the name for you golfers. He's going to talk about flu shots and cold flu prevention and also some sports restrictions on exercises when you are under the weather. Stay with us at Sports Medicine Weekly, our website, sportsmedicineweekly.com. Back with more after this on 670 The Score.